My patient today is Maria Hernandez. The doctor has ordered 3 medications, metoprolol, ketorolac, and metformin. I'm going to begin by doing my first check and making sure everything matches up. Metoprolol, 25 milligrams. The doctor's ordered 25 milligrams by mouth daily with a strength of 12.5 milligrams per tablet. I'm going to be administering 2 tablets. The metformin, extended release, 500 milligrams by mouth daily with a strength of 500 milligrams per tablet. I will be giving Miss Hernandez 1 tablet of the metformin extended release. Now for the ketorolac, the doctor ordered 15 milligrams intramuscular every 6 hours. I will be administering 0.5 milliliters. Everything matches up. I'm going to begin by cleaning my vial. I will be administering this IM injection into the ventrogluteal with a 1 milliliter syringe, a 21 gauge, 1.5 inch needle. Okay. There we go. I'm going to pull back 0.5 milliliters of air. There we go. We'll be doing the scoop and snap method for safety. No air bubbles. Now I'm going to take the blunt-filled needle off and put on Now I'm going to label everything. Now I'm going to grab all my supplies and I'm going to go into the patient's room. I'm going to take my vial with me, clean up my trash. Okay, let's go. Hi, how are you today?
Swell. How are you?
I am doing well. My name is Morgan. I'm going to be your student nurse today. If you give me 1 second, I'm going to go ahead and pull everything up. Okay. All right. Okay, so I'm going to start off. Can I get your name?
Maria Hernandez.
Maria Hernandez. I'm going to double check your MRN, Miss Hernandez. 87. Okay, everything seems to match up. Miss Hernandez, I see here that it says you have no known allergies. What about to any latex or adhesive specifically?
No.
Okay, so the doctor's put in an order for metoprolol, metformin, and ketorolac. So two medications you're familiar with and one that will be new to you. I'm going to go ahead and do my second check. Okay, everything looks good. All right, so I'm going to go ahead and get a full set of vitals on you real quick. Thank you. Let me get your pulse. Okay. I'm going to go ahead and get your blood pressure. Now, Ms. Hernandez, do you know what your normal blood pressure is?
133 or something.
Okay. Okay. Now, Ms. Hernandez, can you rate your pain on a scale of 0 to 10, 10 being the worst pain you've ever felt and 0 being no pain at all? What would you rate your current pain right now?
7.
Okay. And where is that pain located?
Lower back.
On your lower back. Okay. And that's where your ulcer is present?
Yes.
Okay. All right. So that pain you're having in your lower back, the ketorolac is going to help alleviate some of that. Your blood pressure was a little bit high, but that's why we're going to give you the metoprolol. That's going to help decrease your blood pressure. So before I begin, I want to talk to you about some of the purpose of these medications that we're going to give you today and some of the possible side effects. The metoprolol, so we're going to give that to you, like I said just a second ago, it's going to help decrease your blood pressure. Also, you have been taking it for a while, it's a medication you're familiar with. I'm wondering if you've noticed any side effects such as troubled sleeping, nausea, vomiting, diarrhea, even hiccups, palpitations, or even dizziness?
No.
None of those? Okay, so we're going to give this medication to you orally. We do ask after we give this medication to you that you don't use any over-the-counter medications, avoid alcohol, smoking, and we're going to lower sodium intake. And whenever you take it at home, we ask that you also lower your sodium intake. And if you experience any shortness of breath or swelling of your extremities, please call us and let us know. Also, after we give this medication to you, we're going to come and monitor your blood pressure afterwards. Does everything sound good to you?
Sounds good.
Okay. So I'm going to get the metoprolol together. I'm going to double check your MRN. We're going to scan your wristband and put that in. And then we're going to scan the medication. Okay, we got the green light. So I'm going to go ahead and give you this medication and hand you your water. Did everything go down smoothly?
Sure did.
Okay, good. Okay, that medication's been administered. So now we're going to move on to the metformin. You are familiar with that? Okay, so the metformin, we're giving this to you to control your blood glucose levels. Also, I'm wondering if you felt any symptoms before of headaches, weakness, or drowsiness, or even agitation?
No.
Okay, so we're going to give this medication to you orally. After we give this to you, we're going to monitor your blood glucose levels. We ask that we're giving this to you in the morning to prevent hypoglycemia at night. And we ask that whenever you take this medication at home, you don't crush it, you don't chew it, and you don't break it. We ask that you take it whole. Does everything sound good to you?
Sounds good.
Okay, thank you so much. Let me get everything together. I'm going to scan your bracelet. I'm going to scan the medication in. Okay, I have the green light. That is my third check. Okay, here's your medication. And again, here's your water. Okay, Do you feel like everything went down smoothly?
Sure did.
Okay, so now we're gonna move on. Let me document this, and then we're gonna move on to the next medication. Okay, so now we're gonna move on to the kettle rack. Okay, my third check on the medication. Make sure this is the right one. Yes. All right, so with the kettle rack, we're giving this to you for any pain that you're feeling, any inflammation around your ulcer, and any itching you may feel. It'll help relieve some of that. So we ask that, or some of the symptoms may include drowsiness after we give you this injection. I'm going to give it to you right in your hip area, a little below, kind of close to your butt, and then we ask that you please avoid taking any aspirin, NSAIDs, and anything containing acetaminophen. And if you notice any bleeding or fatigue, please let us know. After we administer this injection, we're going to be in here monitoring your pain levels and stuff like that. Does everything sound good?
Mm-hmm.
Okay. So I'm going to start off by scanning your bracelet. Scan the medication. Okay, we have the green line. I'm going to start by, I'm going to grab a pair of gloves. Going to wash my hands. Can I get you to lay down, Miss Hernandez? Do you need any assistance?
I got it.
I take my gloves over here. Now I'm going to lower your pants. Going to be administering the injection right here. I'll clean the site. Okay. Put on my gloves. Okay. Put you to hold that right there. Okay. Now, I'm going to get ready to insert the injection. Pull the skin over to the side, go in at a 90-degree angle. You're going to feel me stick in 1, 2, 3. Go right to the side. 1, 2, 3. Can I get you to hold pressure, Miss Hernandez? Going to drop this in sharps. Okay. Dispose of this in the trash. Does everything feel okay?
Sure does.
Okay. Pull your pants back up. Let me help you sit back up, Miss Hernandez. Okay. Now, does that site feel okay?
Feels great.
Good. Let me document real quick. All right. Sorry. All right. Everything looks good. Let me document here. Everything looks good. So as I said, we're gonna be back in here in an hour and check in on you. If you can feel any pain or irritation in the injection site, please just let us know. Your call light is right here, so please just press that and call us. And do you have any questions or concerns?
No.
Is there anything I can do for you? Let me move your table back into place. Your water's in reach. Get everything out of your way. And I am going to document your vitals real quick. Okay. Everything looks good. All right, now I'm going to close this browser for safety purposes. And I'm going to shut down the laptop. Okay, let me get everything out of your way. Now again, Ms. Hernandez, is there anything that you need?
No.
Okay, and no questions?
No.
All right, well, we thank you for everything today, and we hope that we'll see you in an hour.
See you then.